Yatima Outreach is focused on orphans and vulnerable children, primarily to access quality, affordable education. However, unhealthy kids cannot attain that goal. That's why we have deliberately put our health program to be our objective 2. Our health programs are entirely focused on preventive measures, but if need be, we move to the next tier of treatment or diagnosis. We have set up clinics, but more established is our clinic in Bungoma, which is level 3. In our other 2 programs, that is Mathare and Narok, we still at a very infant stage where we just bring in medics to check on our kids. But we have plans to as well establish health facilities in those programs. When you look at statistics in this country, only about 26% of Kenyans have access to an insurance policy of medical. And that brings in a challenge in the communities that we serve.
The children being sick and not receiving the health care they need also affects their ability to do well in school, to get an education, to be able to get out of these living situations. And it all depends on everything. They need healthcare, they need nutrition, they need education, they need sanitation. It's not just one thing they need.
To support long-term health improvements, first and foremost, you have to have a very clear idea or a very good idea of what the needs are on the ground. So it needs to be needs-based, it needs to be evidence-based, whatever you're building. You need to engage local partnerships, working closely with the government, with the community. And from that point is when then you can bring on board international partners who can then help support meeting those needs.
We can build local capacity by organizing frequent medical camps, also using community health workers to help in sensitization so that to ensure that we have adequate numbers, and also ensuring the facility, laboratory is well equipped as well as the pharmacy is adequately stocked. More medical practitioners can be involved by networking through MOUs with other hospitals.
Medical camp planning is very detailed. It involves a lot of detail in terms of personnel, supplies, equipment, and furthermore having doctors travel from a different country, putting structures on the ground for them to come and just fit in.
We're really excited to be able to have this medical camp. We have a team of doctors, nurses, and physician assistants who are analyzing all of the children's needs. They're able to diagnose, send the children for other medical help, and the great thing is we've been able to bring a lot of medicine to all of the communities. We're working with local Kenyan doctors and specialists and nurses and dentists and eye specialists, all to actually assess these kids and get the help that they need, help provide them an opportunity to be able to learn in the best environment possible, both for them and their families.
At this location, the team here has done a really good job at seeing the kids regularly and identifying kids that have more long-term or need more long-term care. So the goals are having the doctor talk with the social workers and the clinical staff here to establish a plan of care, help the kids receive that long-term treatment and improve their health long-term.
After this, we will ensure that the patients who had some complications that need further medication are referred to the specialist for further investigation and management to better the outcome.
Sustainable medical care in Mathare and Narok is very needed. It's something they have not had access to. We've made progress with the students in Mathare who are at Patmos, but the community as a whole needs much more medical care. Same with Narok. They need simple education over things from hygiene to routine care. They need vaccines, they need preventative care. I think it's going to take a multifaceted approach to accomplish this. You're going to need help from everybody involved. You need help from the people in the community and their leaders, from the local government. I think that any help they can provide, whether getting people insurance, people access to health care, they need health care within their region that's close enough to them that they can utilize it. They need to know what resources are there. And that health care takes funding, so whether they can access insurance, or that can be through donations or charity, what we can do to help these people in these difficult times to help them get there. I think the goal is to have them self-sufficient, where they can ultimately access this on their own, but they need a helping hand to start to get them there.
It is very important that we educate and create awareness of how important it is for our communities to have self-care and live in good, conducive environments. That brings down the need. So that's why we call on to partners of goodwill and people of goodwill across board. We would like medics to be forefront, but we also invite other stakeholders who can just support the medics by either giving a donation of drugs or giving personnel to achieve this noble venture.